Human Metapneumovirus, or HMPV, is a virus that causes respiratory illnesses. These illnesses are infections that affect your breathing. HMPV is a relatively new discovery. Scientists first identified it in 2001. HMPV is related to another virus called RSV, or respiratory syncytial virus. HMPV is a common virus. Many people get it as children. It is spread through respiratory droplets. These droplets are released when an infected person coughs or sneezes. You can also get HMPV by touching a surface that has the virus on it, then touching your face. HMPV symptoms are similar to those of a cold or the flu. This can make it difficult to distinguish between the illnesses without proper medical advice. The most common symptom is a persistent cough, which can vary in severity from mild to severe. You may also experience a runny nose, congestion, and a sore throat. These symptoms can cause discomfort and may interfere with daily activities. Some people develop a fever, which is the body's natural response to fighting off the infection. Monitoring your temperature can help you manage this symptom effectively. In some cases, HMPV can lead to more serious illnesses, such as bronchitis or pneumonia. These conditions require medical attention and can be particularly severe. This is more likely to happen in young children, older adults, and people with weakened immune systems. These groups are more vulnerable and should take extra precautions. Most people recover from HMPV within a week or two. Rest and hydration are key to a speedy recovery. However, the virus can be dangerous for people with weakened immune systems. They may require more intensive care and monitoring. If you have any concerns about your symptoms, it is important to see a doctor. Early diagnosis and treatment can prevent complications and ensure a better outcome. HMPV is found all over the world. It is a common cause of respiratory illness, especially in children. Recently, there has been an increase in HMPV cases in some countries. This is likely due to a number of factors, including the lifting of COVID-19 restrictions. Health officials are monitoring the situation closely. There is no need to panic, but it is important to be aware of the virus and take steps to protect yourself. Section 4, HMPV. How it spreads. HMPV spreads easily from person to person. When an infected person coughs or sneezes, they release tiny droplets of saliva or mucus into the air. These droplets can contain the virus. If you breathe in these droplets, you can become infected. You can also get HMPV by touching a surface that has the virus on it, then touching your eyes, nose, or mouth. The virus can live on surfaces for several hours. This is why it's important to wash your hands often, especially after being in public places. Section 5. Protecting yourself and others. There are a number of things you can do to protect yourself and others from HMPV. This virus can spread easily, but with the right precautions, you can minimize the risk of infection. One of the most important things is to wash your hands often with soap and water. This simple act can significantly reduce the number of germs on your hands. Be sure to lather the soap for at least 20 seconds and get all the way up to your wrists and between your fingers. This thorough cleaning helps ensure that you remove as many germs as possible. If soap and water aren't available, you can use an alcohol-based hand sanitizer. Make sure the sanitizer contains at least 60% alcohol to be effective. You should also avoid close contact with people who are sick. This means keeping a safe distance, ideally at least 6 feet, to reduce the chance of transmission. If you are sick, stay home from work or school to avoid spreading the virus. Resting at home not only helps you recover faster, but also protects others from getting sick. You can also help prevent the spread of HMPV by covering your mouth and nose when you cough or sneeze. This simple action can prevent droplets from reaching others. Use a tissue if possible, and throw it away immediately after use. This helps to contain the germs and prevents them from spreading to surfaces or other people. If you don't have a tissue, cough or sneeze into your elbow. This method is effective in containing the droplets and keeping your hands clean. Regularly disinfect frequently touched surfaces like doorknobs, light switches, and phones. This can help kill any germs that may be present and reduce the risk of infection. Wearing a mask in crowded places can also provide an extra layer of protection. Make sure the mask covers both your nose and mouth for it to be effective. Lastly, try to avoid touching your face, especially your eyes, nose, and mouth. Germs can easily enter your body through these areas. By following these guidelines, you can help protect yourself and others from HMPV. Remember, every small action counts in the fight against the spread of viruses. Section 6. Treatment and looking ahead. There is no specific treatment for HMPV. This means that unlike bacterial infections, which can be treated with antibiotics, HMPV must run its course. Most people recover on their own with rest and fluids. It's important to stay hydrated and get plenty of sleep to help your body fight off the virus. Over-the-counter medications can help to relieve symptoms like fever and congestion. These can include pain relievers, decongestants, and cough suppressants. In some cases, a doctor may prescribe antiviral medication. This is more common for patients who are at higher risk of severe illness. This is more likely to happen if you have a weakened immune system or if you're at risk for complications from HMPV. Elderly individuals and those with chronic health conditions should be particularly cautious. Researchers are currently working on developing a vaccine for HMPV. This involves extensive research and clinical trials to ensure safety and effectiveness. However, a vaccine is not yet available. Until then, preventive measures are crucial. In the meantime, the best way to protect yourself from HMPV is to practice good hygiene and avoid close contact with people who are sick. This includes washing your hands frequently, wearing masks in crowded places, and maintaining social distance.